So good morning. My name is Derek Brindisi. I'm the Director of Public Health for the City of Worcester. And we were invited by Rob and the Worcester Public Schools to really talk about the youth survey that we were able to conduct in the fall of 2013. So I'm going to go over some regional data so you're aware of some of the trends that we're finding, not just here in the City of Worcester, but throughout Central Mass. And then I'm going to turn over to Cassandra Anderson to talk about some of the things that we're doing to develop community partnerships around these issues. So the first youth survey that we were able to collaborate on was in 2011, and it was with approximately 8 different school districts all in central Massachusetts. And then we followed up with an additional youth survey in the fall of 2013, and you can see from this slide here that those were the numbers of students that participated throughout the central Mass region. And so some of you may be thinking, well, why do we choose these schools? So for those of you that don't know, the health department in the city is now a regional health district. So we provide public health services to the communities of Leicester, Millbury, Shrewsbury, and Grafton, and as you know, certainly the City of Worcester. So in the work that we've been doing over the past 6 or 7 years, we're really trying to engage community partnerships and trying to advance health in each one of these communities. So we thought it would be smart to try to work with all the school superintendents across our health district to get a better sense of what of our youth we're engaging in. So the data I'm going to present today is an aggregate. It's all of the schools, and we do that very intentionally because it's easy to stigmatize certain school districts if you just want to talk about one school district. So this is an aggregate, and you can see the number of students that participated in each one of the schools. And in total, 8,700 students participated, and these are grades 9 through 12. So again, I'll just go through some slides, so some of our findings, so we can talk a little bit about substance abuse this morning. And certainly, as Dr. Rodriguez had pointed out, that Worcester has had, not just Worcester, but throughout the state, Governor Patrick declared a public health emergency in March around the issue of overdoses, in particular opiate overdoses. So City of Worcester, we've been working on this issue since 2008, but what we found in this survey was that 147 students had stated that they had used heroin at least once in their lifetime. So that's 147 students, and then you look a couple graphs down, the prescription drug use, 811 students had stated using prescription drugs. And so what we're finding is prescription drugs are on a rise. It's a common drug used today, and the prescription drugs are typically Percocet, Vicodin, those types of painkillers, which are gateway drugs into the heroin use. So when we look at, when I personally look at these, I look at heroin and prescription drugs, and almost 1,000 students have reported using those two drugs. Highly addictive painkillers create a lot of chaos in our community. And I thought I saw Councilor Toomey here there's Councilor Toomey, who we've been working very closely with around some of these issues in Spectrum. And when I remember when we first got involved in this, talking to the folks at Spectrum, they had reported about 850 individuals would go to Lincoln Street, their outpatient clinic, to receive their daily methadone maintenance, and they're up to approximately 1,100 6 years later. So again, we're starting to see this increase throughout our community. So this is the 30-day. This is the youth who have reported misusing substances in the last 30 days. And it's very similar to the last one. The last slide was about lifetime use. This is within the last 30 days. And so you still can take a look at, you see heroin is at 125. I think the last slide was 147. And again, you can see the other types of narcotics, about 450. So again, in the 30-day window when we conducted the survey, close to 600 folks, youth had reported using those types of drugs. And you can see, marijuana on your right, and other types of drugs. I'm going to talk a little bit about marijuana in a few minutes. Tobacco use. So we've been working very closely with Councilor Rivera, who's the chair of the Public Health Committee, City Manager Augustus, to try to advance the tobacco control ordinance in the City of Worcester. And I guess when we look at the overall numbers, some folks would say, well, we really don't have that big of a problem in the community when we think about tobacco use. I would argue that differently, because although that when we look at our youth, 9% had reported smoking cigarettes, and that's where people want to focus their energy on cigarettes, but we don't stop there. We look at all types of tobacco use, and cigars and chew, and a lot of all these emerging tobacco products. And when we add the numbers together, we have almost 20% or over 20% of our youth had reported using some type of tobacco product, and that's a problem, because right now our adult smoking rate is about 16%. And so if we look at our youth engaging in tobacco products, they're exceeding our adult use. So again, Big Tobacco is very smart, and they think about how they market their products. And then when they market their products, they do it towards their youth because they're trying to addict the next generation of tobacco users, not just cigarette users. So I want to spend a little time talking about marijuana and perception versus risk. And as you all know, about 2 years ago, medicinal use of marijuana was passed. And so when I have anecdotal conversations with youth, what oftentimes I hear is that it's safe, right? It's healthy to smoke marijuana. It's legal to smoke marijuana. And so the perception that they're getting because of this new law that allows marijuana to be used for medicinal purposes is that it's okay to smoke marijuana. And so you can tell here just by this survey that youth, over half of youth think it's not a risky behavior to engage in marijuana use. And then you can look at the slide to your right, and it shows that perception versus use. When you think it's a risk to do something, they're less apt to do it. But you can see the slide, when they don't think it's a risk, they're more apt to do it. And that slide depicts that. So this slide here, again, we focus a lot of our energy on engaging high school students. There's a program here at North High, I'm About All This Life. It's really a social norms campaign trying to get the youth to think differently of who's doing things and who's not doing things. Because the vast majority of students aren't engaging in this type of behavior, but there is a small percentage. But the perception out there is that they are engaging in this. The state Department of Public Health has a youth movement called WEA-TV, where it basically states that 84 of our youth are not using tobacco products. So the point of me telling that story is that if we can get at these students at a younger age, not just in high school, but try to get them at the middle school age, we're more apt to prevent them from engaging in these high-risk behaviors. You can tell from this graph that the vast majority of our youth are starting to engage in high-risk behaviors in the middle school ages. So these are some emerging trends. And I was talking a little about tobacco. I don't know if anybody has heard of the e-cigarettes or some of these other fruit-flavored or candy-flavored products, but there's not a lot of adults that are out there that are smoking grape-flavored cigars, at least to my knowledge. But again, they're marketed, they're pretty packages, they're flavored, and it's really to try to get youth to try to experiment with these drugs. And we testified before a committee about a month and a half ago, and there was one individual from the community who was trying to make a point. I don't think he sold his point very well, but what he did bring was these packages he found in playgrounds. And so the point is that our youth are accessing these products. These products are in our convenience stores, and they're being used. And again, nicotine is the addictive drug that they're being addicted to. And the e-cigarettes are not that much different. Again, an e-cigarette, if you don't know, is an electronic cigarette. When they have electronic cigars now, they can be flavored as well, just like these other products. And it's a water vessel that gets vaped or vaporized, and it contains nicotine, the addictive product in cigarettes. So again, students start to experiment with this stuff. They start to get addicted to nicotine, and then quickly they're turning into other tobacco products. And Philip Morris and R.J. Reynolds, they love that. K2, Spice, these other products, although are illegal, can be found in convenience stores, not just in Worcester, but throughout central Massachusetts. It's more or less, it's a synthetic drug that is smoked. It's caused death. It's caused a number of different overdoses. It's not regulated at this time. But again, this is a drug that we're finding most common that our youth are using. And so the reason why I bring up some of these pictures is because I know that Cassandra and others from the department have done presentations with school nurses and health educators, even parents throughout the region, and no one has ever seen these products. And we have other products we bring too that they look like little cartridges of candy. And so if these products are sitting on a desk in a classroom or sitting on a desk in a child's bedroom, most parents wouldn't know that these are tobacco products or synthetic drugs that are being used just because of the packaging alone. So getting back to some of the other data that we were able to bring today is, for years, motor vehicle injuries was the leading cause of unintentional death. And you can see from this slide here that as motor vehicle injuries or deaths decrease, we're starting to see an increase in overdose deaths as well. So again, a lot of this has to do with policy. So having great policies like seatbelt laws and speed limits have decreased the number of unintentional injuries. But at the same time, because of some policies around prescribing narcotics or painkillers to patients, we're starting to see an uptick in the number of overdoses. And if Dr. Hirsch was here, who's our medical director, he would talk about, over a decade ago where pain became the fifth vital sign. And so now when you go to the physician and you have pain in your tooth or something happened to an injury to your arm or something, they show you that chart and they have all 10 smiley faces, and they ask you to rate your pain. And that all came about because all physicians were starting to be taught over 10 years ago, you have to treat pain, you have to treat pain. So they started treating pain, and they would argue, most physicians argue that is caused in large part why we have such a high rate of prescription misuse and abuse these days. In the dentist's office as well. So this is just a graph that just, again, outlines the number of deaths versus all poisonings versus opioid poisonings. And what you can tell is the vast majority of the poisonings that are happening throughout the state are related to opiates. Again, Percocet, Vicodin, heroin, things of that nature. And so, again, I mentioned a little bit about some of the drug treatment that's happening here locally. But again, you can tell, I keep going back to the opioids because that's clearly where we're having struggles. And over here, you can look at the number of admissions as it relates to all types of drugs, and heroin surpasses all other drugs clearly. And then you can see like crack and cocaine are on the decline. Others like marijuana have stayed steady over the years. So I'm going to stop my comments now, and I'm going to turn it over to Cassandra Anderson. Cassandra works at the Department of Public Health, and she leads all of our substance abuse efforts, not only here in the city of Worcester, but throughout the region as well. Thank you.
Thank you. So I'm going to talk, all right, I think that's a little hard to read, but we have a plan that we put together with the community a few years ago. We spent a lot of time looking at and assessing with community partners what were the key things that were really important to work on when it came to health in this region, and behavioral health came out as one of the top things. And we have these 5 different areas: healthy eating and active living, behavioral health, primary care and wellness, violence and injury prevention, and health equity and health disparities. And so when we looked at behavioral health, we broke it out into 2 pieces. Mental health came out as a very important thing to work on, but also addiction and substance abuse disorders were talked about by just about everybody who participated in this community planning process. So we came up with a number of different goals and strategies and objectives to work on these. And I'm going to present some of the work that we've been doing. So recently we went through almost what would be a mini community health improvement planning process just for substance abuse. So we took that work that we had done to look at the overall problem in the region, and then we brought partners together again and said, all right, well, how are we going to really work on this? So we assessed some more and did some planning, and we came up with some new strategies, and we established a regional group to work on these strategies. We had some coalitions that were working either on a specific population or on a specific topic, and we brought everybody together to think about how we could work together better in all of our communities and have more cross-collaboration. So we have the Regional Response to Addiction Partnership that we're coordinating with the help of many of the partners that I see in this room this morning. So one of the things that we're doing is looking at youth and how we can prevent them from beginning to use. And one of the things that we've done is work with the Hope Coalition and the Youth Connect agencies to look at how we can influence the behavior of the most at-risk youth in the region. And so we've used something which is called a social norms and social marketing approach to create this campaign called I'm About This Life. It uses positive messages, images, and behaviors to influence young people about what their peers are doing and to think about their future and how they want to live their life. And so some of the things that we have up here you can see are the social media that's linked to the campaign. We have a traveling art show that was done by some of the youth. We have some of the data that we got in some of the smaller programs. We surveyed youth specifically in that program and then came up with numbers for them to associate with the peers in that specific program so that it was really tailored to the place that they're at. We're also looking to educate families about the issue of particularly medicine abuse, because when you look at what parents are educated on, most of them have thought about marijuana and alcohol, some of the bigger, more well-known drugs, and they've talked to their kids about that. But when you ask them about some of these other things like medicine abuse, they don't know anything about it, and they haven't talked to their kids about it. So we've been doing some education through campaigns, through presentations, and also we've gotten these med return disposal boxes for medication installed in police departments across the region, so that now there are free options for people to dispose of their medication in a safe way. This is the safest way to do it. The reason why they were only in police departments was because the DEA had a rule that narcotics could only be taken back by law enforcement. So you couldn't give your narcotics to anyone once you took them home from the doctor's, from the pharmacy. You couldn't give them to anyone except for someone in law enforcement. So these were put into police departments. But recently they changed the DEA regulations. So now pharmacies are allowed to take back prescriptions. This was very recent. This was in October. So at this time, the pharmacies, the regional and national retail chains are looking at their policies around this and coming up with plans on how they're going to either accommodate this or figure out how they're going to market it to their customers. So we're not advertising that yet, but at some point we'll be working with them on that. We have talked to the pharmacies about it. So, as Derek was mentioning, there is an issue with prescribers that many of them are not aware of the abuse that's happening when they're prescribing opioids. So one of the things that we've done is work to educate prescribers on this issue, and the scope of pain training is something that is out of Boston University, but this is nationally funded training program and has been approved by the FDA, and they travel around the country and do this training. Jeff Baxter, who's here in Worcester and is a family medicine practitioner, is one of the certified trainers for this program, and he has done the training here in Worcester and has done some shorter trainings with us as well. So even if prescribers can't get to a half day or a full day training, we understand that a lot of them don't have enough time for that. So we've put together a grand rounds presentation that takes about an hour and is a good introduction to this issue and touches on the major themes. And then what physicians can do is they can go online and do a longer version of this program and get more credits. But this is something that is now required for their licensure to continue to practice. They have to get a credit in this pain management, risk management, when their license comes up. And they also have to register with the PDMP, the Prescription Monitoring Program in Massachusetts. And that's something that we're also trying to promote because there's very low usage right now by physicians across the state, but it's been proven in other states to have significant impact on the number of opiates that are prescribed to people, that when doctors don't realize that someone is getting multiple prescriptions for the same medicine at different doctors. So if they use this system, it really reduces that. Calling it quits is something that we've done with the Worcester Public Schools, and it's a tobacco cessation program that's specifically designed for youth and uses motivational interviewing to reduce the use of tobacco by youth. So if a student is identified in the schools as having a tobacco problem, if they get caught smoking, they can be sent to the school nurse, and every single school nurse in the Worcester Public Schools has been trained in this program and can work with them on quitting smoking. So I wanted to bring this up. This is something that is really important to save lives. It's nasal Narcan, and this year, the entire police department in Worcester was trained in nasal Narcan, and they're now carrying it so that if there is a 911 call for an overdose, they can administer this if they get there first before other emergency responders and ambulance. Most ambulances are carrying some form of this drug, which will, if it's an opiate overdose, this will potentially save someone's life. They will come out of the overdose that they're in and then can be brought to the hospital for additional treatment and care. But that's actually a very important piece to this, because some people don't realize that this is just a temporary fix. So people, if they call 911, they really need to get that person to the emergency room so that they can have the proper care and recovery from that overdose situation, because this product is only designed to block an opioid for around 30 to 90 minutes, depending on the person and how much they've used. So it's really important that people know that they can call 911. There's a law in place that protects people from prosecution if they call 911 during an overdose, that there is a life-saving drug that's available that first responders have, and that when the first responders arrive, that they need to go to the hospital and not, there are some people who believe that when they've been revived from that overdose, then they'll refuse transport to the hospital, and then they'll go back into the overdose later on. So it's really important that people get to the hospital. But this is really important because I think a lot of people here know that we've had an increase in overdose deaths in this city, and if we can intervene at that time, prevent that death, and then get someone into the treatment programs, which are here today, and they're going to talk about the services that they have. We know that treatment is effective and recovery is possible, and there are many people who are living in recovery successful in this community. And so preventing the death and getting them into the right treatment services is incredibly important, saving lives. We're also working with community partners to raise awareness around this issue in general. That event was The Anonymous People, and it's a documentary film about recovery from substance abuse and talking about your successful recovery and getting that message out to the community so that people know that it is possible to successfully go through treatment and recovery. And it's trying to raise the voice about this epidemic, but then also that there's hope for people who have been abusing substances. So we also we co-sponsor the Recovery Walk during Recovery Month with Everyday Miracles Peer Recovery Center, and we also work with Learn to Cope to support many of the activities that they're doing in this area, and we educate people about the programs that they have for parents, which are very important because we know that if you have supports from your family and friends, that you're much more likely to be able to successfully complete your treatment and recover. So if anybody has any questions.
Right there. Got my mic right there?
Two questions. I'm from PAL, the Parent Professional Advocacy League, and I have two questions kind of regarding, you mentioned that Area 2 is behavioral health, but you focused a lot on substance use. Have you guys really thought about co-occurring disorders or doing sort of an integrated treatment for mental health and substance abuse?
Yeah, absolutely. And we have another staff, Paige Bick, that is focusing more on the mental health work, but I am always thinking about how we can work with mental health providers as well. I think it's complicated, but we absolutely invite them to the table whenever possible. So if someone is interested in working with us, you know, we welcome that. And we have some relationships with mental health providers already in the area. I think there is a lot of overlap here, and we definitely understand that. I would love to work with your organization too.
Well, I'm asking because we're partnering with MORE on a grant on co-occurring disorders. But my second question actually has to do with SBIRT. Has Worcester kind of started implementing SBIRT? For anyone who doesn't know it, it's screening, brief intervention, and referral to treatment. And I know Massachusetts has started, and they have like 6 regional high schools that have begun implementing SBIRT into their systems. But it seems that since Worcester has already trained its nurses in motivational interviewing, which is a large part of SBIRT, is it something that Worcester is thinking about implementing in their school system?
Well, I would actually refer that back to the school to talk about, but we have at our department tested the craft tool, which is the youth version of the Espert tool, with some of the youth programs that we work with to see how that would work, how many youth it identifies, and think about how we would do the referral to services. But it is something that I would like to talk about because there are, you're right, there's a number of actually different organizations that are working on that right now. The MSPCC has a coalition that's working on promoting Espert, and the statewide District Attorneys Association is also looking at promoting Espert in schools across the state. They haven't quite come up with their exact plan yet, but they have been working with different community partners, and they've met with us, and we've talked about that.
Great, thank you so much.
Cassandra, just two quick questions. With the nasal Narcan, have the firefighters been trained as in use of that? Because I find in Worcester, they're often the first responders on the scene.
So the firefighters have not yet been trained in that. They applied for a grant from the state to do that. I don't know whether or not they've gotten that grant yet or figured out the training process, but I know that they have applied. So they're interested. I think they're just working on the logistics and planning of that. It does take some time, especially when you have a lot of staff, because you have to, there's a very particular training for first responders around nasal naloxone and how to administer it. It's longer than if you went into a Narcan pilot site, which in this region, the Narcan pilot site for the public is at AIDS Project Worcester, and anyone can go in there at any time and ask for it. Learn to Cope is also a distribution site, so parents who go to that program can ask for it. And I should point out that Walgreens Pharmacy is also carrying this, and you do not need a prescription to get it. You just walk up to the pharmacy counter and you ask for it, but you will most likely have to pay for it out of pocket because most insurance plans are not yet covering this. So the cost can be quite a lot of money for some people. But I do know that they are working on it, the fire department. But I would think that it's going to take a while to get everybody trained. It took, I think, almost 6 months for the whole police department to be trained, because it just to get everyone to go through that, you can't train everybody in one day.
Right. No, thank you. And my second question is just around the success of the implementation of this intervention. Like, since the police have been trained, do you know anything around like how successful that has been?
Yeah, so for every overdose that happens in the city, our department gets a report, an incident report from the police, and it gives us details on that overdose, and it lets us know whether Narcan was administered and then what hospital the person was sent to. So it is successful, and that's why we're trying to promote as much as possible. Call 911 every time.
Excellent. Well, thank you, Cassandra.
Thank you.